Dr. Gorman, thank you so much for being with us, and thank you for your time. I want to talk about how many years you have been doing this.
I'm one of the old guys. I started in 1983 in Austin, started my training in plastic surgery in 1981, so almost 3 decades.
Let's go back to the old days of silicone implants.
Sure.
What were the dangers of that, and what did you see as a surgeon?
Well, back when I was in training, and I think this was probably true for a lot of my colleagues, I was taught that all saline implants leak. And
Saline or silicone?
Saline. All saline implants leak, and that silicone implants will last forever. And I fully thought that someday someone would excavate Austin and find bones and implants. It turns out that most things man-made don't last forever. And we did start seeing silicone gel implants that had torn or leaked or whatever, and often these were found as mammographic findings. There would be, instead of a smooth outline of the silicone gel implant, there would be a little peninsula or a little odd look to the implant, which would alert us that there's a defect in the implant. Sometimes a sonogram would verify that. And when we would go in and remove the implant and the scar around it, it was somewhat messy, because in those days, if you took an implant and made a cut in them, the gel would come out like a thick, viscous oil. Well, you ask about danger. I don't think they were dangerous. When the implant controversy hit in the early 90s, I had already been in practice for 10 years. I didn't have any sick patients, so I was skeptical of the whole thing. In fact, I started doing research right away and never stopped using silicone gel implants. But after 93, I could only use them in women who fit the protocol of some of the studies that I was involved in. And some of those studies are still ongoing, even though the FDA has now put the gel implants back on the market. The difference between the gel implant of today and the gel implant of before 93 is that, number one, the shell of the implant is thicker, and secondly, the gel is truly a gel. I have one with a slice in it, and you can see there's no leaking. And so this is a cohesive gel. So even if there is a stab wound or a knife wound or something, the gel's not going to go anywhere. Thus, it should be easier to remove when we have to replace it. Typically, these implants are strong enough to withstand a lot of abuse. And it usually takes a force enough to break a rib to break one of these implants. But again, it's man-made, and over time, with wear and tear, a leak or a pinhole could appear in the shell, and it's nice to know that the gel, being cohesive, is not going to come out.
Saline versus silicone. As a surgeon, as a seasoned surgeon in this area, what would be your recommendation? What would you like to work with?
Well, this is controversial, and it depends on who you ask. I think the majority of my colleagues like silicone gel implants, and I am definitely in that category. There are some who still believe that saline implants are better. And certainly saline implants are mandatory in certain procedures. Which we'll talk about later, the umbilical approach has to use a saline implant. My criticism of the saline implant is multiple-fold. One, that this is a saline implant. It comes empty. We fill it. So there's more manipulation. We have to handle the implant. We have to put in a fill tube. We have to take saline from another source, usually an IV bag, and fill it. And then hope that the valve stays. And then it's like a water bag. It doesn't have a good natural feeling. And lastly, it will leak. I still believe the old adage that all saline implants leak. It is man-made, so a pinhole could develop in this, like in the silicone. If that happens, though, this is a liquid. It's going to come out. And so a woman will call me not saying, I'm concerned that my implant may have a leak, but rather they'll call me and say, my implant collapsed, and I need to get that fixed. If the implant were to leak, it's just salt water. So it will be absorbed by the body. There will be no damage to it, except there will be required more surgery, more anesthesia, another incision. If this implant were put in from a distant site, like the axilla, or the armpit, or the belly button, it can't be removed the same way. It's too far away. So one would then have to commit to another incision. So even though the saline itself isn't dangerous, it does lead to things that could be dangerous, like more surgery. Whereas if you got a pinhole in the silicone implant, you probably would never even know it, unless a mammogram showed a little defect in it some way. Now, you would know it if you got hit strong enough to break a rib, and then we would be concerned about the implant, and an MRI would help to show if it were intact or not. Okay. And if it were not intact, we would want to replace it.
Okay, the old days of the silicone, if it would puncture or rip or tear, then it would be that oozing that go into the body. You're telling me with the new silicone, it could be punctured, and it would not ooze into the body cavity.
Right. And let me correct one other thing you said. In the old implant, I did not mean to imply that they were particularly dangerous. They were great implants, but they were weaker, they were more easily broken, and the gel, being more of a liquid than a true gel, was more of a mess to clean up. But there was never any science that showed that the gel went from the breast, even when it was ruptured, to the brain or to knee joints, or some of those fantastic stories that we were being fed back in the 90s. Rather, there's a scar envelope or capsule that forms around the implant. And most commonly, when an implant had a leak, it still was contained within that capsule. When I would remove one, I would usually try to stay outside of the capsule, dissecting all of it, and try to remove the entire unit intact, even if inside the implant was ruptured. Sometimes I was able to do that, sometimes not. But even when the implant was, or the gel was everywhere, we were pretty much able to get it out and clean it up. Now, it did get into some lymph nodes sometimes, and so one could have palpable lymph nodes in the armpit after a long-term rupture or leak, and that was a problem. I don't think we'll see that with this new implant. Now, I've only had to remove one in 15 years that was torn, so I only have one case where I've had to remove one of these new implants that had a leak in it. So I don't have a vast experience with that.
Who is the biggest manufacturer of implants?
Well, for a long time, that's another change. In the early 90s, there probably were 15 companies that made silicone gel implants. And then when the controversy hit, there were lots of lawsuits, and a lot of companies went belly up. Implants used to cost about $200 a piece. Now they cost about $1,000 a piece. And there's two major players. There's Allergan, it used to be McGann, makes a good implant, and then Mentor is the other one. That's the one I use more because I think it has a better feel to it, and I like the company. I think it's a good, strong, ethical company, and I've worked with them for many years, and I've done research for them. So I have I don't have a financial tie to them, but I have an experiential tie with them. Mm-hmm.
So can you hold the saline and the silicone?
Let me get one of these that's not broken.
Kind of do a compare and contrast.
Sure. Here's the silicone. Here's the saline.
Okay. Oh, yeah.
And try this one.
Yeah, this is water balloon. This is water balloon day, and this is definitely more natural.
And this one comes already sealed. There's not a valve to fill this with, so we don't have to manipulate. In fact, I don't even touch this implant until I'm ready to put it in. I
Right.
don't let anyone else touch it.
Right.
And I change gloves before I touch it. So I touch it very gently, but with the saline, we have to put a tube in it, and we have to fill it and manipulate it. So
Well,
it's,
you know, with the saline, when you jiggle it,
yes,
you could almost,
yes.
you could almost hear a woman walking down the hall.
Yeah, well, if there were an air bubble in it, for sure, we could say, here comes Pamela down the hall.